Vamos con la segunda exposición que se denomina La cultura de la salud mental en el sistema educativo y los programas de educación socioemocional, y está a cargo del Centro Anna Freud de Londres. El centro es una ONG líder en el mundo en el área de salud mental de niños, adolescentes y familias. Junto con el gobierno británico desarrolló el programa School in Mind, que apunta al desarrollo de una cultura común y transversal alrededor de la salud mental en las instituciones educativas. Roisin McEvoy lidera programas de salud mental en centros educativos, es máster en educación por la Universidad de North London, con más de 20 años de experiencia docente. Adelante, Roisin.
Thank you very much. Thank you for the introduction, and thank you to everybody for the amazing warm welcome that I have had in Montevideo on my very first visit here. I'm hugely enjoying it, and I've been enjoying and really incredibly interested by the presentations of all of my other colleagues this morning and this afternoon. So thank you to all of you. Firstly, I thought it would be good to tell you a little bit about the Anna Freud Centre, but just only very briefly. We're based in London in the UK, and we as a centre have been pioneering mental health care and support for children and young people for over 70 years. I haven't been doing it for 70 years myself. I'm not quite that old, but I am getting there after 20 years working in school. I'm trying to make this work, which is also making me feel aged. Well, there we go. The centre is a national charity. So we are a children and young people's mental health charity, and we combine research and innovation with clinical practice, training and dissemination. Apologies, thank you. And our work is based on, the other way, based on three really important principles to us, and they guide our work. And they're principles that chime, I think, with an awful lot that we've heard from other colleagues speaking today. The first is that children, young people and families are at the heart of what we do, echoing so many of our today's speakers. We are really committed to discovering and sharing the best way to help children, young people, families, their carers, and the professionals who work around mental health problems. And our third core principle is that we aim to strengthen our impact through collaboration and through partnership. Yet another reason that is such an honor and a privilege for me to be able to be here today and to hear from colleagues here in Uruguay and from farther afield. Could I have please a raise of hands if you are someone who currently works in a school or used to work in a school? So I just want to have a little, see of who my audience is. Oh, loads of people. So I know I am among friends. As a former teacher of many years, I'm going to follow the teacher's pattern with any presentation, which is I'm going to tell you what I'm going to tell you, then I'm going to tell you it, and then at the end, I'm going to repeat and tell you what I told you. So let's begin with me telling you what I'm going to tell you. So I'm going to tell you about the UK context. What challenges have we been facing and what are some of the approaches that we've been trying? Then I'm going to talk to you about a really special role that has emerged in UK schools, which we call the Senior Mental Health Lead. What is that role and what training do those colleagues receive? And then I want to talk to you about what we mean by a whole school or college approach to mental health and well-being, and to talk to you a little bit about some of the resources that are available to implement a whole school approach for schools in the UK and beyond. So a little bit about the UK context. In the UK, the prevalence of mental health conditions was rising even before the pandemic. And back then it was estimated that only a quarter of children and young people who needed mental health support were actually able to access it. Then, of course, we had the pandemic. And the most recent figures, which I have from the National Health Service in the UK digital survey from July 2021, estimates that between 1 in 6 children within that full child and young person age group of 5 to 16 were identified as having a probable mental health disorder. Now, the reasons for this are not clear, and there is some conflicting evidence coming through now that there may be some signs of recovery. So the most recent report from the Department for Education in the UK, called the State of the Nation report, seems to suggest some recovery. But and some of this may also be, and the fourth bullet point there around the level of referral to children and adolescent mental health services being the highest that it's ever been in the UK, may also be down to greater awareness as well as greater prevalence. So these figures, I think, provide some of the picture, but there's still a lot that we don't yet know. But one thing we do know is that when we talk to young people and we talk to adolescents, especially those who have got mental health problems, they tell us that all of their experience of the pandemic, and especially the school closures, by and large, made things worse for them, with over 80% saying that to us. A little bit more about context. This slide really is about me trying to provide you with some timestamps around how things have changed in the UK and how we think about mental health and well-being for our young people has changed. And really, a really first important milestone in 2015 was the Future in Mind report, which was all about how we were going to transform both national and local approaches to children and young people's mental health, including really wide-ranging aspects of the provision policy, what was going to be invested in, and what training was going to be provided. And this was followed fairly quickly by the Green Paper in 2017, which is a really major guide to those of us who work in young people's mental health in the UK. It's called Transforming Children and Young People's Mental Health. And the focus there was really on workforce development, training for school staff, the development of a group of workers who are called mental health support teams, who work alongside and within schools, and an ambition to reduce waiting time for specialist help. Of course, we had the pandemic, and some of those ambitions have not been fully realized, but it has still provided a really good roadmap and a guide for us in the things that we want to achieve for our children and young people. We do have other kind of important moments in time and documents that kind of inform this work. We had a change in terms of statutory requirements about the teaching and learning about mental health in school in 2021. It is now statutory for students to be taught about mental health. And also earlier this year, a really helpful guideline came out from the National Institute of Care and Health Excellence, NICE, all around social, emotional, and mental well-being best practice. And that included reference to a whole school approach, which I'm going to talk quite a bit more about in my talk, and about how young people should access targeted support. Now, at the Anna Freud Centre, I've said we have aspects of clinical work, we have aspects of research, but the division that I work in is called the Schools Division, and we're really determined to see this work from the perspective of young people in their schools and from the perspective of the staff who work in schools. And we know that school connectedness is a really important protective factor for young people and their mental health. And our vision is for all schools to be mentally healthy. And through our work, we support education staff to adopt a whole school or college approach to mental health and well-being, and to try and put that at the heart of their community and everything that their school does. To help with this, we produce evidence-based training resources and programs, helping schools and colleges to make mental health and well-being of their students a priority. Within the division, we do, within our school division at the Anna Freud Centre, we do a number of programs that support this. These are a few of them. Senior Mental Health Lead Training, I'm going to talk about a bit more in a moment. We also had a program called the LINK program. This was government-funded program that looked to bring together colleagues who work in schools with colleagues who work in health and colleagues who work in non-government organizations and charities, and to help them to craft a shared language and a shared understanding of each other's work, and also to come up with action plans on how to work together. We also have another program called the Education for Wellbeing program. Now, this is a research program. We are mid-trial, so I'm not allowed to tell you very much about it. There are no results yet, but it was something that I think will interest many people in this room, because this trial is looking at a number of interventions that have showed promise in various parts of the world. And the UK government have funded the Anna Freud Centre to trial these interventions in schools in England, and to then conduct there are control schools who receive no interventions, and then to make comparisons in terms of the impact on the mental health and well-being of young people. So watch this space for more information on that and which interventions work. All of our work really in the schools division is covered by Schools in Mind, and Schools in Mind is most importantly a network for anyone who is interested in the place of mental health and well-being in schools. So mainly teachers, but lots of other people who work with young people and in this field of mental health and well-being. And also we have our Mentally Healthy Schools website, which I would recommend to you. It includes many, especially if you work in a school, it includes many resources that you could draw on for use. I said I would talk a little bit more about senior mental health leads. Now, senior mental health leads is a major UK government initiative that all schools nominate an existing staff member, a teacher, a leader, an administrator in the school, and they will receive training to take on the role of senior mental health lead. It's a financially incentivized training. So schools have been incentivized and supported to identify and train one person. The role of that person is to have oversight of the whole school approach to mental health and well-being, including how it is reflected in the design of really everything that happens in school, the school's practices, the school's policies, for example, behavior policy or attendance policy, how mental health and well-being is reflected in curriculum and in pastoral support offered in school, and how staff are supported with their own mental health and well-being, and how pupils and parents can be engaged. The role also includes signposting and supporting the identification of at-risk children and those who are exhibiting signs of mental ill health. This role also includes working with local mental health services and making referrals as appropriate. And the role includes oversight of the delivery of any interventions that are happening within school. The senior mental health lead in school is there to support all staff as well who are in contact with children and young people who may have mental health problems. And they oversee the outcomes of any interventions and make decisions about interventions going forward. So all schools should have a trained senior mental health lead in place by 2025. But I think it's really important for me to say something about this training, because what we're not doing is taking a teacher or a school leader or a school administrator and turning them into a clinician. They are not a clinician. They remain an educationalist, a teacher. So someone whose major role in school continues to be being a teacher and being a school leader. But the training they receive helps them to implement strategic and cultural change within their school. And I think that's really important. So the training is actually relatively short. It's 2 full days training. Most teachers complete this training online, in fact, because that has really helped us in terms of reach and allowed teachers to be able to access the training who otherwise would not be able to travel to London or one of the other major cities in the UK. After the initial training, these colleagues are also offered reflective spaces, opportunities to meet again with the colleagues who were in their cohort that they trained with, and to talk about the challenges that they faced and the successes that they've had. And they become part of a community of practice and a much wider network of senior mental health leads working across the country. And their role is developing policy within their school, mapping local services. They do lots and lots of reading and finding out about things and access lots of resources from us. And ultimately, they're putting together an action plan for a whole school approach to mental health and well-being. So I've talked a lot about this phrase, a whole school approach. And what do we mean by this? Well, to put in a little bit of context, the whole school approach for us really has its roots in Public Health England's 8 principles for a whole school approach. And I'm going to run through these principles really quickly. The first is leadership. This is the core principle. It's represented here in the center because it's the most important one. Somebody in school, in each school or college, who's supporting and shaping all the efforts of the school to promote well-being for its children and young people. And then secondly, really springing from that is the principle of culture, that the school ensures it has or develops an ethos, an environment of respect, and one that values diversity, that the school acknowledges cross-cultural contexts, and that really puts relationships at the heart of everything that the school is doing. And I think as teachers, we know that, that relationships are probably the most important thing that we do. Thirdly, curriculum. So one of the principles here is that mental health and well-being should be part of our school curriculum, that students should learn about it and teachers should teach about it. So we're talking about here teaching about resilience or social and emotional learning. And we're talking about making sure we have a workforce of teachers who feel trained and confident and supported to provide safe teaching spaces and learning spaces for mental health. The fourth principle is that of student voice, and we've heard a huge amount about that today, and I think that's probably been one of the most impressive themes that have run through the whole day so far. The importance of genuine student voice, students being able to influence decision-making within their school. And the voices that are heard within school are diverse, so lots of different ways and mechanisms to hear from our young people and from our children about the decisions that are made about them and for them. The fifth principle is that staff are developed to support their own well-being, first of all, so that they then are also able to support the well-being of children and young people. This one is extremely close to my heart. I was a teacher for 22 years. I know that I did say, well, I would welcome if you tell me I don't look old enough for that to be true, but I certainly feel that it did age me in some ways. It was also an enormously rewarding job. But I do know that for us teachers, often our day-to-day work can be challenging, it can be exhausting, and it can be a challenge to our own well-being and to our own mental health. And so this principle is incredibly important to us in the Schools Division at the Anna Freud Centre, that colleagues often tell us that the thing they find most stressful about their job is that they feel ill-prepared. They haven't had the training, they don't have the knowledge, they don't have the skills or the practical skills to do the job they're being asked to do. So making sure that our schools colleagues have that training and professional development is a really central principle to this work. Principle 6 is about developing the school's ability to identify need and to monitor the impact of interventions. It's not enough to know that we need an intervention. It's not enough even to commission that intervention, but to then track its impact and be confident that it is having the impact that we want for our children and young people. Principle 7 is about engaging with parents and carers. Again, relationships here being so important. And also, of course, many of our parents and carers turn to our schools for signposting and for help and advice around mental health and well-being. I'm a parent myself of 2 teenagers, and I'm still learning and working hard to keep learning as a parent. And I know that I value very much the support that my school and the teachers at my school offer me with that. And then principle 8 is about schools knowing where to go for targeted support and where to go to make a referral for specialist support for their young people. So these 8 principles from Public Health England really informed this notion of a whole school approach to mental health and well-being. And I hope you're starting to see that this is a framework that puts children and young people's emotional well-being now right at the heart of education policy in the UK. The pandemic really did, for us, shine further light on just how important schools and colleges are in promoting mental health, and as well as supporting children and young people when they need it, a whole school approach or whole school or a whole college approach to mental health and well-being can improve things like attendance and attainment and really benefit the whole school community. Is it just as easy as that? Well, there is some emerging evidence about whole school approach that I think is relevant and worth touching on here. Just a few thoughts really about how it can be implemented, what some of the challenges might be, and maybe some of the ways to overcome those. So from the kind of evidence that we've got right now, we know that this is a complex business, putting in place a whole school and college approach. And we really do need to manage expectations about how long it may take to bring about change and which changes will be able to happen quickly. However, having said that, we do know that with appropriate training and support, school and college staff can be effective implementers of mental health and well-being programs. Given that truly whole school approaches are complex to implement in practice, the evidence points to a staged approach being advisable here. Don't try to do everything at once, seems to be what the evidence is telling us. There is no single gold standard intervention, rather that interventions need to be selected by schools and colleges based on what the staff and the students and the families of those schools have identified as being priorities. They need to know that context. But we do say there are manifold programs available and many that schools can choose from. And this has certainly been a challenge for schools in the UK. And so at the Anna Freud Centre, we try to really provide help and support about choosing the interventions for your school wisely. I've said it's complex. So in order to answer this issue of complexity, we work to translate the 8 principles, the Public Health England 8 principles of whole school approach into what we call the Anna Freud Centre 5 steps framework. Now I have a video.
Supporting good mental health is a vital part of helping children and young people thrive. Schools and colleges that promote mental health improve well-being and attainment, giving children and young people the best possible chance to fulfill their potential. The Anna Freud Centre has created a free, simple, evidence-based framework that puts research into practice and helps you to respond effectively to your school or college's individual needs. Our framework is built around 5 steps. As you make your way through the steps, you can record your strengths, progress, and areas of development on your interactive action planning tool. Leading change. It takes leadership and vision to create transformation. 5 steps will help you put mental health at the heart of everything, from policy and improvement plans to day-to-day lessons and assemblies. They will also help you to build a culture that supports well-being and resilience. Working together. 5 steps will help you bring everyone together. Staff and pupils, governors, parents, carers, and mental health services, to create a whole school community that promotes mental health so that everyone feels respected and supported. Understanding need. In a class of 30 15-year-olds, 4 are likely to have a diagnosable mental health problem. 1 could have lost a parent, 7 may have been bullied, and 5 may be self-harming. 5 steps will help you identify and support children and young people with a range of needs. The steps will help you set up effective peer support, ensuring pupils are listened to and can contribute to the well-being of the school community. Promoting well-being. 5 steps will signpost you to a range of resources to help you promote mental health across your school, including assemblies, on notice boards, and in RSHE lessons. You'll also find tools to help you create safe spaces and to ensure that mental health and well-being is prioritized by SLT and governors. supporting staff. To create an environment where children and young people can thrive, it's vital to support the well-being of staff. 5 steps will help everyone feel safe and supported in providing for pupils' mental health and well-being. 5 steps offers you simple, practical ideas you can use right away. Written by teachers and school leaders with guidance from mental health experts, it lets you move at your own pace, making small changes that can build over time into a true sustainable transformation. It will put you in control, letting you make the changes you need in your school for your community. So why not access our free interactive resource today? To find out more, visit annafreud.org/5 steps.
So this is a short animation which we made in order to be able to share with our colleagues in schools who we describe as being time poor, to help them to understand very quickly the ideas behind the 5 steps framework and how it works. And I hope that you could see from the animation that built into our 5 steps framework is this understanding that every school and every college is different, and that the 5 steps framework is about allowing the colleagues who work in those schools to create their own approach, to tailor something that works for them. So it's a tailored approach, but it's based on the evidence of what works. And the 5 steps framework allows schools and colleges to set their own priorities and to build their approach over time in a truly sustainable way, and a way that transformation can actually be sustained over time. This slide is just about explaining the background, but I think that's clear that it kind of draws, the 5 steps draws its content from the 8 principles that I've talked about already, but it's been refined over time. So we have an amazing team in the schools division of former teachers and clinicians who work together to kind of refine these resources and make them useful for colleagues in schools. It was then piloted with teachers in the UK, and then we made changes in response to what teachers and school leaders, school governors and parents and young people told us when they piloted it. So I said I was going to tell you what I was going to tell you, then I was going to tell you it, and then I was going to tell you what I told you. So let me just recap really briefly the 5 steps. So for us, these are the 5 steps to implementing a whole school approach to mental health and well-being for your children and young people, for your families, and for the staff in your school. The first step is about leading change. It's about culture. It's about engaging key stakeholders. It's about aspects of intersectionality. It's about relationships. And then it's about policy and planning for change. The second step we call working together, with student voice being at the center of that, but also working closely with parents and carers and mental health services beyond the boundaries of the school. The third step we call understanding need. So that's allowing colleagues in school to understand what tools and measures may be used by mental health services and what they might mean for their young people, to understand that there is a range of need, to understand some things around risk factors and protective factors, and very especially to understand how school attachment is a powerful protective factor for children and young people with regard to their mental health. And that understanding need piece, again, must include listening to and understanding what the young people are telling us. Step 4, we call promoting well-being. That's everything from school assemblies and notice boards and the visibility of mental health and well-being in the school through to the curriculum and having safe spaces in school to talk about mental health. And finally, and perhaps for me, most importantly, almost as a first step, is to think about the staff who are going to do this work in school. That those people feel that their mental health and well-being is also supported and cared about, that there is a positive culture of change within schools. This is achieved through professional development and training and through appropriate supervision for staff. That's about all that I wanted to say, other than to recommend to you some resources and signposting. So much of what I've talked about is explained in a lot more detail through our website. And if you wanted to know what the senior mental health lead training looked like, you could have a look at that page there. So it's annafreud.org/SMHL. And thank you for being incredibly patient and kind listeners.